Take your seats. The meeting will come to order and we'll get started here. Welcome back to the September meeting of the Legislative Oversight Committee on Health and Human Services as we prepare to move into the interim and continue to meet our responsibilities of providing oversight and giving opportunity to hear from the department and others as we continue in our role here. Today we have our committee sergeant at arms from the House. We have Young Bay, Bob Rossi, Garland Shepard, Larry Elliott. From the Senate Sergeant at Arms, we have Kenton Lewis and Charles Marcellus with us today. And you will find, I believe they were just posted online, all of the handouts for the committee. If you're listening online or in the back of the room and are looking for the handouts, you can find all of those. They have been posted now online. So if you'll go to the committee website, you'll find them under today's meeting. And we will begin with comments from the Secretary. Madam Secretary, welcome back to the Oversight Committee. Thanks for being here today, for your time, and welcome any opening remarks that you may have at this time.
Thank you very much, Mr. Chairman, for inviting us back, and a good morning to the co-chairs and to the committee members. Together, we have made significant progress in the Department of Health and Human Services. Thanks to the effort of the department, the governor, OSBM, and the General Assembly, the Medicaid budget finished this year in the best shape it has been during the last 5 years. That is due in part to better budgeting, better collaboration, and most important, to paying attention. This is another clear sign that the path that we are on is the right path for the division, for the department, and for the state. We continue to make progress towards a sustainable and an accountable department. And most importantly, we continue to build a very strong foundation for the future. And I'm proud of what our team has accomplished in this short period of time that we have been here. Under the leadership of Dr. Cummings, we are transforming the Division of Medical Assistance, Medicaid. We're utilizing national experts to not only help us with our day-to-day work, but also to make sure that we are creating the core competencies in Medicaid that are critical to the strong $13 billion organization with the flexibility for future reform. We look forward to presenting and taking your questions on Medicaid a little bit later today. At DHHS, in addition to the long-standing and well-documented issues, we always have new challenges. And these challenges are presented to us almost on a daily basis. But we will keep working hard to make sure that we are doing the right thing for the state. One recent example of how the department has addressed one of our most recent challenges is the Ebola virus. This issue was on the front page of every paper. But it must be easy for people to miss actually how much work our staff is doing to ensure the safety of our citizens. This issue really gives you a sense of the scope of work that we do in our department. At the suggestion of one of the co-chairs, I have asked Dr. Davies, the chief epidemiologist for the state, and the section chief for the Division of Public Health to attend and to provide us a little update on the Ebola virus. Dr. Davies.
Dr. Davies, welcome to the Oversight Committee. Thank you for being here today and for your service. You may proceed.
Thank you for the opportunity to give you this update. As you are all aware, there's an unprecedented outbreak of Ebola in West Africa. The outbreak began in March, or was first recognized in March of 2014 in the country of Guinea, and has subsequently spread to 5 countries, with the most recent numbers of cases being over 3,000 cases with close to 2,000 deaths. And yesterday the WHO announced that they anticipated an increase in cases in just the country of Liberia of about 3,000 in the next 3 weeks. The impact on North Carolina in this situation early on was in the returning volunteers who had served in Liberia. We're fortunate to be the headquarters state for 2 missionary organizations, SIN USA in Charlotte and Samaritan's Purse in Boone. Both of these organizations have supported missionaries in Liberia who had been treating Ebola patients. On the weekend of August 2nd and 3rd, families of the American missionary healthcare workers returning to Charlotte were in communication with the CDC and the North Carolina Division of Public Health about how they could safely return to Charlotte. In collaboration with the CDC and the Mecklenburg County Health Department, we conducted a risk assessment of what the exposures of those 8 people were, and determined that they could return, CDC determined they could return by commercial aircraft because they had not had any documented exposure to Ebola and they were asymptomatic. We then worked with Mecklenburg County Health Department upon their arrival to monitor them for symptoms for the 21 days from when they returned from Liberia. This involved a public health nurse calling twice a day to ascertain that none of those people had developed a fever or any symptoms. Fortunately, they all did very well, and they are no longer being monitored. They're out of that 21-day period. The weekend of August 9th and 10th, 2 American physicians who had been treating Ebola patients in the Elwa Hospital in Monrovia, Liberia, returned by private jet to SIN USA. This was again after consultation with the CDC, Division of Public Health, and Mecklenburg County Health Department. 2 of the 3 people returning on the private jet on risk assessment were found to be at high risk of exposure for Ebola. They had treated the patients who were in Emory Hospital, who wonderfully were able to recover with very good care. But these doctors had treated these patients in Liberia with not as good infection control protections at high risk to themselves. Therefore, they were not cleared to go on a commercial aircraft, and when they arrived by private jet at Charlotte Mecklenburg Hospital, they were greeted by the public health nurse with many years of experience who came on board in full personal protective equipment to personally take their temperatures and interview them to confirm that they were asymptomatic, which they were. We then had them remain on the grounds of the headquarters to finish out their 21 days of observation. This involved frequent meetings and communication and daily communication with CDC on these doctors and the husband of the hospitalized patient's status. Again, we were very fortunate. None of them went on to develop disease. Additionally, the interviews that they were able to provide to us and we were able to provide to CDC has helped inform CDC's response in Africa, because they were firsthand witnesses of what issues needed to be dealt with. We stood up our incident management team and were in that mode for approximately 2 weeks as we developed communications for universities and colleges, local health departments, and the community to inform them about what the risk might be of anybody traveling back from those countries. We developed educational materials and sent them out, and local health departments have been screening returning business people, volunteers, and students to assess them for risk since August. At this point, nobody's been identified as high risk, and all people who were temporarily quarantined are healthy.
Thank you very much for the update and for what your team has been doing. Very much appreciate that. At this time, we will move on to item 3 on the agenda, which is the state contracting process, and we'll hear from the Deputy State Purchasing Officer, Sherry Gar.
Thank you. I'm here, I was charged with coming in and explaining a little bit about the difference between sole source and personal service contracts. As you can see up here, sole source contracts, the way the state defines it, it's normally considered a waiver of competition because sole source is just one of the conditions of waiver. And I'm not going to read you all those, but you have a handout, and one of the waivers is where personal or particular professional service is required. There's emergencies, there's standardization and compatibility, so there's many different conditions of waiver, and one of them is a sole source where there's nobody else but the individual can do that particular service. What the state does encourage, though, is competition. So although we do allow waivers, the first thought that you need to do is there competition? And whenever that's practical, we want to do that. And if a waiver is contemplated, agencies may negotiate with a potential vendor in an effort to acquire the quality of the commodity, service, or printing that they need. A solicitation document is still needed, that they request an offer from the vendor. We still have the state's terms and conditions involved with that solicitation document. And any waiver that is over $10,000 does need to come to state purchasing contract to be approved prior to entering into that contract. The definition of personal service contract is personal services to provide a professional individual, a person that is like uniquely qualified and on a temporary basis. And some of those positions we talk about are doctors, dentists, attorneys, engineers, somebody that's uniquely qualified that usually has a certification in that particular profession. And normally they are using that skill. So we wouldn't want to hire a doctor as a personal service contractor if he's going to be just emceeing a meeting or something. That would not really make that a personal services contract. And as part of the procurement transportation right now, we are working on new rules, which would include updating some of the definitions that are in the current rules on items such as personal services contracts. The criteria for determining an appropriate use of a sole source or a personal service contract, there's many different things we need to look at. The first thing we have to do is determine, will competition enhance the price for the state? Determination that the competition will not enhance the quality, and if we determine that an individual vendor is uniquely qualified. Then there's a determination that the services required cannot be performed in-house by a state employee. And due to the nature of personal service contracts, it may not be practical to post it and try and bid it out. For an example, if the services of a particular individual are needed to provide a subject matter expert in a court case, there might just be one known person that can do that. And determining the waiver competition is appropriate for a personal service should be based on the definitions we saw at the very beginning, one of those 18 different conditions. And if a person is using his or her professional skills and if the services are provided on a temporary occasional basis, that too is part of the definition. It's somebody who's uniquely qualified, a professional, and it should be on a temporary basis, not 2-3 years. It is not meant to be another way of getting an employee. It may be difficult to advertise using our existing channels because they really are geared towards goods and services and not towards human resources. There are advantages and disadvantages to using this type of service. Again, competition should be sought whenever practical. It's difficult to determine whether other services are available or whether the individual or firm is uniquely qualified. You do still have to do some background research looking into that. You can't just assume somebody is without doing a little bit of research. It could be a potentially higher cost due to the lack of competition. Sometimes the scope of work in the deliverables are not as well defined, and there's a chance for scope change and increases, which we like to call scope creep, that sometimes happens when you have just one individual doing something, then the scope tends to get larger than was first intended. And oftentimes material basis versus deliverable basis, and the state ends up getting what it's paying for. So sometimes they do like time and material versus a project. As far as funding sources, the statute, rules, and policies and procedures are the same regardless of the source of funding. So it doesn't matter what type of contract it is, or the funding does not matter. The only time that it would matter, sometimes we do get grants that come in and they do specifically name